Dr. Tom Roselle live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I'm live in studio. Happy Easter and happy Passover to everybody. It's a beautiful day in Washington, D.C. You need to get out and relax and enjoy the day, go for walks, and look at the flowers. You know, it's that time of the year. You need to do that. We're broadcasting to you from 105.9 FM and AM 630 WMAL. I'd love to talk to you today. 888-630-9625. 888-630-WMAL. That's how you find me, and that's how you talk to me. Perhaps we can put a solution to a problem that you've had, you've tried, you've applied, you've done everything, you know what to do. Well, this is your opportunity to change things, to make a difference without drugs, without surgery. That's why we're here every Sunday at 12 noon. We don't miss a beat. Try to keep it live and entertaining and informative for you, as we will today. But we're here to answer your questions. Have some interesting information, news that has come up over the last week or so, and also over the last month or so. Some of you have seen an interesting article that was published about the FDA putting out a new warning, and this came out last month. The new warning about statins. Many of you have heard me go on a diatribe, if you will, about this for a long time. The FDA is now admitting that statins, cholesterol-lowering drugs, need to have warning labels on them for many things. You know about the muscle pain and weakness that takes place. You know about the dramatic increased risk of cancer, the abnormal increase in liver enzymes, weakness, dizziness, nausea, stomach pain, constipation, diarrhea, sore throat, sexual dysfunction, neuropathies, headache, pain and burning. Well, after I read all of that, you say, well, what else could happen? Well, there's two very significant things that can happen, and it seems to be paralleling a lot of the problems that we have with cognitive dysfunction and blood sugar handling. Yes, folks, guess what? The FDA did come out and say that statins now can cause diabetes and memory loss. Huh? What's that all about? Well, yeah, it's been out there for a long time, and it kind of sustains all the things that I've been telling my patients for I don't know how many years now. The problem is that so many of these things are swept under the rug, but I'm here to tell you, and that's why we're here every Sunday, to give you the truth on so much of what you don't know. When your doctor says take a statin because your cholesterol level's 205 or 210, and you have to look at him and say, really, what's the chance of my having a heart attack anyway at that level? You know, when I was in school a whole lot of years ago, you know, in the day, as they say, normal cholesterol was about 225. Normal bad cholesterol, LDL, was about 125. Now the shift has taken place and the research has come out, and we want to have cholesterols under 200 and we want to have LDL levels under 100. Well, guess what? First of all, guess who did the research? Yes, you know, Big Pharma, right? Well, that's the truth. It happens to be exactly that's what the situation is. However, let's take a look at what really takes place. And as you've heard me say, that it takes a whole lot of application of this stuff. Matter of fact, you can treat 100 guys for 5 years with a statin and you'll prevent one heart attack. The odds aren't so good. So why would you expose yourself to a drug that does all the things that we just talked about, plus the fact that it can cause diabetes and memory problems? Well, the connection between statins and diabetes was made a few years back. It first came out in the literature. We've known it clinically, anecdotally, for a long time. But in 2008, there was a study that had ended with 18,000 people taking the drug Crestor. And other studies followed that showed the same thing. Matter of fact, one study in 2010 published in the Lancet, a very prestigious medical journal, and another one, which in 2011 was published in the Journal of the American Medical Association, and then again another one in 2012, just recently, last month, published in the Archives of Internal Medicine, came out with the same conclusions. Now, that's 4 studies, 4 years, proving statins increase your risk of diabetes. Don't let anybody tell you that it doesn't. It just is that way, and you're increasing your risk. Well, up until now, the other piece, memory loss, has been sort of the thing that, you know, we've put in our back pocket and swept under the rug, and they said, well, it's a rare side effect of statins. But, you know, the FDA now necessitates a warning label for it I think that it may not be so rare. May not be as bad or as good as they say it is, right? Well, memory loss in people taking statins have experienced a lot of things like trouble finding the right word. I do that once in a while, and I'm not even a statin. Forgetting tasks that they started. You did something and you forgot to, trouble following conversations, lack of concentration. All of those things have been attributed to age-related dementia and, oh my God, the beginning stages of Alzheimer's. And then they do things for Alzheimer's and they say, well, that's not it. Guess what? It's statins. I don't know about any of you, but here's the deal. I've been telling everybody for as long as I can remember that statins across the board are dangerous and they cause more problems than what they're serving. There's not anybody out there that can argue that, particularly if you're in the business. If you're in the business, in the drug business, in the sales business, in the clinical business, and you don't know the ramifications, the side effects, the counterindications of these drugs, then you're not doing your job, then you're crazy, because the stuff is straight up. Drug manufacturers tried to pass the blame of all those things by saying things like, since people on statins are generally older, and, they might be experiencing age-related problems. Yeah, bunk right. The deal is simply this. My book, Ageless Health, Health as a Do-It-Yourself Program, is simply a straightforward treatise on you have control. You're the one, because of your timeline, the decisions that you make, and sometimes the lack of those decisions are the ones that, that cause you to be where you are right now. Well, memory loss comes about because of things that we do, things that we're exposed to, things that we don't do for ourselves. For example, if you don't get enough exercise, you don't get circulation in your body. You don't metabolize fats and toxins and get rid of them the way you're supposed to. If you don't strengthen your body and you sit around and you don't try. If you don't use your brain, if you don't challenge yourself on a day-to-day basis. But then you go from that place, and we know that most of us don't eat well. We're going to talk about that later on in the program today. We're going to talk about healthy eating a little bit and what you really can do to make a shift. But you add drugs to it, particularly statins. Now, listen, I am not totally against every medication on the planet, but I am against the ones that are killing you. I'm against the ones that are causing iatrogenic diseases. What's that? Physician-induced. Yeah, the ones that your doc gives you and you end up with other problems because of something that he gave you, and then he gives you another drug for that and something else for that. Your body's extremely forgiving. It will change and turn itself around. But you have to have the data. You have to have the information. So let's talk a little bit about that. It's all about marketing. It's about the effectiveness of getting the message out to you. So they're marketing you to put you on these drugs. And remember, I've said over the years, drug companies don't want you dead. Because if you're dead, they can't give you a drug. And they don't make any money. So they want to keep you in that maintenance place. And I want to get you healthy. I want you to reclaim your wellness. I want you to turn things around. So, drug marketing efforts, people are terrified, of cholesterol. They've got you to the place right now where you think that cholesterol is the big bad demon, the big bad wolf behind the bush that's going to eat you. Well, the first thing is you got to have cholesterol. Second thing, if you don't have cholesterol, your hormones don't work, your brain doesn't work, your body can't function, you have no energetics, and you can't make something called cortisol. By the way, and everybody thinks cortisol is bad, but you have to have enough cortisol. So, see, there's a pathway here that is very straight up. You have to make sure that things are working in your body. Unfortunately, when we drive the cholesterol levels down, when we get rid of all these things, all kinds of stuff go down the tubes. Hormones like estrogens and testosterone and progesterones and adrenaline, and we just talked about cortisol. These are things that are the byproduct, if you will, of normal cholesterol metabolism, plus the sheath that goes around the nerves. It's called the myelin sheath. All the long nerves in the body and the brain have this myelin, this protective coating. And when you don't have cholesterol, you can't make the sheath that protects the nerves and the neurological pathways. So when you're driving cholesterol down, you're actually causing your neurological system to be destroyed. You don't get it, right? Well, it's because of the manufacturing marketing that has been taking place to convince you otherwise that cholesterol is not a good thing, that cortisol is not a good thing, that we have to alter these natural things that are there and get it squared away. Your LDL cholesterol is the bad cholesterols, the guy that's going to eat you and destroy your arteries and so forth. Well, they need to be there. They help bring certain things through the bloodstream. You have to have them. We don't want to drive them down so they're non-existent. And we got into this attitude, this mind frame, if you will, that they need to go away. Well, not so much. The good guys, the HDLs, they go through the body and they help pick up any excessive cholesterol and bring it to the liver so the liver can break it down and it can be changed into other substances and your body can recycle it and so forth and so on. If you don't do that, body doesn't work. Things happen to you. You increase all kinds of risk factors. We just talked about a bunch of them, including cancer, including dementia, including diabetes, including all of those things. The problem is this, and let's talk about this a little bit. Let's go through it and let's talk about the memory patterns, the memory loss, from people taking statins, all right? We talked about their problems with finding things and their problems with cognitive patterns and concentration and conversational attention. Those are real things. Think about it for a minute. How long have you been on a statin? Do you feel weak? Do you feel dizzy? Do you feel like, you just don't have what it used to be mentally anymore since you've been taking that drug? It's a real deal, folks. It's a real deal. You can't set it aside. So let's talk about, natural ways of handling your cholesterol. And by the way, I want to give you a ratio. And I do ratios. When my patients bring in their blood work, and I look at things, I said, and they tell me, well, my doc said everything is fine. I said, yeah, I know, they could be fine. It's probably within parameters, but let me look at them first. You have to have ratios. You have to have fundamental ratios of HDL to triglycerides, HDLs to LDLs, and so forth. And your HDLs to your triglycerides should be less than 2 to 1. Your HDL to LDL levels should be 4 to 1. And if you're in those ranges, no matter what everything else is going on, actually things are really pretty good for you. They're actually pretty decent. So what do? How can you lower your cholesterol to get it within a relatively decent framework? If your LDL levels and your HDL levels, the ratios between the two of them are good, and your triglyceride levels and your HDL level ratios are good, then it comes to a place where how bad are things? Well, your cholesterol can be over 200, and if those things are cool and your your inflammatory levels are down, things are really working the way they're supposed to. But what can we do for ourselves? We can eat well. We can exercise the way that we're supposed to. We can do mental challenges. We can make sure that we're taking supplements. We can talk about handling our life and being in control of our life. And that's what we're going to talk about, a little bit of dietary patterns. Welcome back, everybody. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're broadcasting 105.9 FM and AM 630 WMAL. 888-630-9625, 888-630-WMAL. That's how you find me. That's how you ask me questions. And to that extent, we're going to go to the phones. Valerie, thank you for waiting. How can I help you?
Yes, hi, how are you?
I'm doing well. Happy Easter and happy Passover.
Same to you. I'm glad you're there today. Good. I'm a 62-year-old retired woman and not very active, overweight, pre-diabetic. My hands are asleep. At first, they used to go to sleep just at night. I'd have it under the pillow, take it out, shake it, and wake up. Now, for the last 3 weeks, both of them have been asleep. My penmanship I can't write anymore. I feel heavy. I feel unstable when I'm walking. And my ankles are swollen, and I have a headache every morning. I went to the doctor. He says I have carpal tunnel, but I don't know.
I don't know either. So let me, well, actually I do know, but I don't know from his point of view, but I'm going to tell you the truth about that. Anytime your hands go to sleep, now I would assume at this point with all the complaints you have, your doctor has ruled out vascular problems, circulatory problems with you. Is that true or not?
He hasn't done that lately, but About a year ago, yes.
Okay. So the fact that this is chronic, it's an old situation, now it's there kind of continually, and, you're in bed at nighttime and you have to move around to move your hands. Now, a carpal tunnel-like problem, a true carpal tunnel syndrome is the median nerve, which is cervical 5, which actually affects the thumb pad, the thumb, and the pointer finger.
Right.
And then there's 2 other nerves that go down there. That's, by the way, that's the median, then you have the ulna, and then you have the radius nerve. Now, those are the ones that control all the muscles to your hands and your forearm. But you've got to trace it all the way back. Where do those nerves start? They start in your neck. Mm-hmm. And they go down into the arms, into the forearms, into the fingers. Most tingling and most carpal tunnel-like presentations or neuritis or neuralgias of the hands start in the neck because the nerves are being stretched or pinched or irritated. And that ultimately will give you a headache. That'll give you neck pain, particularly the fact that you said that you have a headache when you wake up in the morning. It's very typical of that type of presentation. So my best guess at this point is that you don't have something that's originating in the hand. You have something that's in the neck that is causing a problem in the hand. So
that's what I think, because about 40 years ago I was in an industrial accident, and I guess now it's caught up with me. Right now, if I move my neck in a certain position, I feel this kind of sensation or shock wave going down my shoulders.
You're talking about a neck and shoulder problem. You need to get yourself, you're out in Bowie, Maryland, is that right?
Yes.
Okay, you need to get to a chiropractor that can do the work, or an osteopath. You have to have your neck worked on. If you don't do that, over time, it's going to get progressively worse. And this is what I would tell you to do. Write me a note. Go to rosellecare.com. And I will send you a referral of somebody that I would go to or I would send my family to.
Okay, so you don't think I need to see a neurologist?
Absolutely not.
Oh, great.
Okay? But you got to get this thing squared away because otherwise it's going to get worse. But go to rosellecare.com, send me a note, and I'll send you a referral.
All right, sir.
Take care of yourself.
Thank you.
Bye. Thaddeus, how can I help you, sir?
Yes, hello. Good day.
Good day.
Happy Easter.
Happy Easter to you. How can I help you?
Okay, March 15th, I went for a dental evaluation, and the dentist told me that all my teeth need to be extracted, and I had the teeth were infecting the rest of my body, so he prescribed a 10-day supply of penicillin, 500 milligrams.
What kind of penicillin?
Was it PC? I guess a tablet form?
Okay, just straight up penicillin. Go ahead.
Right, 500 milligrams.
All right.
Okay, March 25, I was finished with the penicillin, right?
Okay.
And then on March 31st, which is 6 days later,
yes.
During the time I was taking the penicillin, there was no kind of reaction that I was getting. But anyway, March 31st, 6 days later, both my legs and feet began to swell really bad. I could hardly walk. And
that's a side reaction to any kind of antimicrobial, and particularly penicillin. So what it's telling you, and you don't have, when you take something like that, you don't have to have the effect immediately. It can be cumulative and start over several days later, 5 days later, whatever. And one of the side effects of taking a penicillin is swelling, is gastrointestinal problems. That sort of thing will show up, but it'll show up later on. But also the fact that you have a very serious dental problem and you don't know whether or not that was singularly effective for that. There may be other things that need to be done. When you have an infection in the bone and the jaw, it's telling you that generally you have an immune system that's very low, that's been challenged, and that there are other pieces of that puzzle that are taking place. So when you extract the teeth, and each tooth in the mouth has a relationship, believe it or not, to an organ system, to muscle areas, to spinal levels, and so forth. So when you challenge or damage or injure by extraction the alveolar ligament that holds the tooth into the bone, you can have other far-reaching ramifications. So there's a couple things here that you have to take into consideration. And by the way, what I'm talking about is something called neurological tooth, and it's something you can look up and so forth. But
well, I am going to get them all extracted. I haven't got them extracted yet.
Okay.
They need to be extracted.
Right.
But anyway, I was so bad that I actually had to go to the emergency room.
What do they do for you there?
Well, they gave me EKG, made sure my liver and everything was working.
And everything,
my heart and
everything come back okay?
Yeah, right. Everything came back okay. But anyway, they prescribed furosemide, some kind of for high blood pressure, furosemide.
Yeah.
FUROSE.
Yep, I know the drug.
Right. Anyway, I'm thinking about not even getting it because I want this heal naturally now. In other words, want my swollen legs basically get better.
Sure. I mean, I'm surprised they didn't put you on lasix or something that neighborhood.
It is lasix. That's what they did, but I haven't filled the prescription yet. In other words, I haven't gone to the drugstore to get it prescribed. I want to see if this heals naturally.
What I would do, and I would encourage you to do, is go get vitamin B6. And get the phosphate form of B6, take about 100 milligrams of B6 a day, divide the dosages, 25, about 25 milligrams 4 times a day, and also go to the health food store like Whole Foods or Trader Joe's or Mom's or something like that, and ask them to give you a really strong, potent natural antibacterial or normal bacteria for your intestinal tract, good probiotic, right. And take whatever the dosage is on the bottle, double it 3 times a day. And the combination of the two, see if they help you. My suspicion is it will, and you'll avoid the side effects of the lasix and the medication.
Well, I'm going to take it. I don't want to take it. In other words, my swollen leg should go down eventually, right?
It should, unless it's caused some damage. But try the B6; it'll help you, and it won't do any harm. No. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio. 888-630-9625. 888-630-WMAL. I don't know about that music, but I'm ready. Let's play. Talking to you about statins and the effect on the body. We said earlier that in addition to all the other nasty things about statins, including muscle weakness and increase of cancer risk and dizziness and nausea and sexual dysfunction and you name it, it also is now the culprit and published in several medical journals recently that you can end up with diabetes and very significant cognitive dysfunction. And because most of you who are of the statin age, if you will, are older, and they kind of put it in their back pocket and say, well, it's because it's an older person's problem, the loss of memory and those other things. Well, not so much, my friend. Remember, every medication that you take has a side effect, including what this gentleman was telling us about just before the break with penicillin. Penicillin is known to cause swelling. It is known to cause damage to the kidneys. It is known to cause problems with the liver, and that's what causes the problems. So be very careful. The side effects are real. This is not something that should be taken lightly. It's not something that should be taken just because your doctor told you should take it. There's other ways of handling things. When you have a systemic infection that is affecting your teeth and your doctor tells you have to have your teeth extracted, the next question is, what am I doing in my life that is causing this infection to occur? Why? Sheila, how can I help you? Thank you for holding.
So much. All right. I am on 2 drugs, Topril and the lasix that I just heard about. And the other thing I'm taking, because I've been diagnosed with colitis as well, is the fluoric acid every single day. All right. The lasix I only take as needed for the edema. But I have recently been diagnosed with glaucoma. I've had the concentration loss, everything that you've mentioned except the diabetes, the weakness, the liver spots coming out on my face. And my blood pressure is normal. And so are my triglycerides. All that is normal.
So now
but I have, this lack of concentration, starting jobs that were a cinch to me. I don't finish.
That's exactly what the side effects are. You're hitting them right across the board.
Yes.
And with Topril specifically, you can have all kinds of things, and it can affect your respiratory system. It could start giving you, what they call GERD, that burning in the esophagus and the stomach area. Your blood pressure could actually go the other way. You could go instead of being high, it's going to go right down around your toes.
Well, mine is very low.
Yeah, so it's the side effect. So what you need to do is find a doc that is going to get you off of this junk. There's a lot of other ways. Lasix is a diuretic, and by definition, if you look it up, what is going to happen is it's going to pull potassium out of your body.
I'm taking potassium daily.
How much?
Oh gosh, I can't tell you.
Over
the counter.
Are you taking over the counter? The prescription potassium is something called Cater, and it's 500 milligram tablets, but you need to take at least 500 milligrams of potassium a day. I don't like the stuff that they're prescribing. It's just a strict elemental potassium. I like natural forms that are better. But you need to make sure you're taking enough of it, because otherwise you will experience a lot of the things that we're talking about right now.
Yes.
So you've got to find someone who can help you with this. It's not okay.
Yeah.
You live in Chevy Chase. You can give us a call and hook up with one of my docs, and they'll take you through it. They'll, in turn, handle all the problems that you're talking about. They're going to check your neurology. They're going to check your chemistry. They're going to set up a program to take you, and they will work with your physician step by step to handle this stuff.
And who is that, please?
Roselle Center for Healing. We're right in Fairfax. Actually, we're about a quarter mile off of Route 50. We're not way too far from you, because I'm up close to you right now in Chevy Chase doing the program. So it only takes about 15, 20 minutes to get there without traffic.
Right. See, I've had the ablation done, and everything's been well along that, and I don't know why I'm still on the topo.
Because it is the thing that they do. That is the way they treat stuff, regardless. So they open up the book, and they say XYZ, and you get XYZ, and that's the end of the story.
It's just routine.
It's routine. And so you need somebody who knows the other piece. They know the ABC instead of the XYZ.
Right. I've had essential tremor as well, but it seems to be getting worse.
That's the drugs you're on are going to cause that.
Right.
Sheila, you got to do something, hon.
Okay.
All right.
Thanks.
Talk to you later. George, how can I help you, sir?
I feel bad with my silly little question here after listening to everybody with these chronic problems.
It's not silly. What can I do for that elbow pain?
This is my problem. I'm an avid weightlifter. I have been for over 40 years. I'm in perfect health. The only thing that bothers me at times is gout. I've adjusted my diet, so really I haven't had an attack in over a year and a half. When I do, I take Colachine.
Well, there's other things more natural than Colachine. Colachine's got some interesting side effects, but there's a homeopathic, by the way, called Lydium polester that you can take, and also black cherry juice. And
Trust me, the cherry juice thing, when I feel the attack coming on, that's what I've basically switched to.
But watch your red meats, because red meats and shellfish and beans and those sort of things are going to increase your purity and metabolism, which is the thing that causes the gout.
Cool. Like I said, I'm 59 years old. I'm in great shape. I'm 6'5", 255 pounds. Like I said, cardio is good. Everything's good. But, my elbow hurts so bad at night, it wakes me up. I've done the stretching before I work out, after I work out with the hands, everything.
When did it start?
Probably about 8 months ago.
Do you have as much power in that side as you do in the other side when you're lifting?
Yeah, I do. Actually, I kind of push through the pain, but I still have the power in the elbow.
Okay, so probably what's going on, first of all, any joint space can be affected by any muscle and any other joint space. That's number one. Second rule is that the muscles that are causing that joint space to fire go to the spinal system. So if we're talking about the elbow and the arm, it's going to go to the neck. If we're talking about the leg and the back, it's going to go to the low back. So you have to find out where it started. But here's a concept that you need to think about. There's something called a reactive muscle pattern. And to make it easy, the biceps and the triceps are reactive to each other. It means when one is contracting, the other one is supposed to relax. Correct. But sometimes, because either the fascia gets really tight or the muscle is misfiring because it's not working at 100% capacity, then you're going to get the other muscle having to do more work to stabilize than it should. So what you have to do, the muscles have to be tested, and then you have to find out exactly where it's coming from. We see a lot of this stuff because of the years that we worked with different professional athletes. I was a doc for the Washington Mystics for several years. We deal with a lot of the Redskins and so forth. These are the kind of things that show up because of their type of activity, if you will. You're pulling weight around, and if you're doing full range of motion and your posture's good and so forth, you generally mediate that type of problem. But nevertheless, what happens is that all you got to do one day is just kind of cheat a little bit. So to get that extra lift, you slightly turn your arm because you're a trained athlete at this point, and you can compensate by using other muscles. Now the muscles become reactive. There's also enzymes. Phosphatase is one of the things that works with the fibrils, the little muscle fibers. And if you don't have enough phosphatase in your diet from different sources, then the muscles are going to misfire. But ultimately, once you hit this place where you have the problem, now you've got to fix it. and you have to fix it by finding out what created it, what triggered it, and you put that into place, and things will work better. Anyway, what I'm trying to tell you is simply this. It's not a bad thing to fix. It's probably pretty straightforward, and be more than happy to have one of my guys look at it for you because of our experience in the area. But when something's around for 8 months and doesn't go away, you got a chronic problem that's causing an inflammatory reaction within the joint space that ultimately will break your joint space down, by the way, until you get it fixed.
Wow, didn't want to hear that, but I understand where you're at with that.
But it's very doable.
Well, I've listened to what you have to say. I'm in love with the anti-drug thing. I don't take statins. Had all the check for fatty liver, everything. So I'm very much an anti-drug type person, but I don't want to be ignorant in the fact that if something can help, whether it be homeopathic or regular drugs.
At this point, what you're telling me is it's beyond. There may be some anti-inflammatories, meaning natural things. We call them proteolytic enzymes, amylases and bromelains and proteases and so forth that will help keep the inflammatory reaction down. There are things like tremor, which is a homeopathic application for trauma, for injury, that will also decrease and help heal the tissue. But it has to heal in place. It has to heal in the right position for it ultimately to resolve itself. Make sense?
Yeah, it does. Actually, I emailed you while I was waiting for you to take the call. So, I'm anxious. I'll contact one of your doctors probably Monday or Tuesday.
Okay, great.
See what you can do.
All right. Well, I'll get back to your email, too. So, looking forward to meet you. Take care, George.
Taking my call.
Thanks for the call.
Take care.
888-630-9625. That's 888-630-WMAL. We're talking about several different things today. We're going to get back to the phones in a minute. We have several more calls. I want to try to get to as many of you as I possibly can. But I want to go back to that piece of statins. It's really important because more and more people are being put on just prophylactic statins. You reach a certain place, and there's physicians out there who believe that once you turn 50, you need to be on statins, you need to be on aspirin, you need to be on all that nonsense. And I call it nonsense simply because it is. It's one of those things that when you think about does it work opposed to what the reactions are and the ramifications, and I don't know, for my money, guys, it's not something that's going to go into my body, particularly when there's so many other things that you can do to handle it, from taking a 500 milligram niacin, taking your omega-3 fatty acids, fish oils. You can beat this thing. You can exercise. You can get off your duff. You can start changing your dietary patterns. You can eat things that you should be eating instead of eating the garbage that you put in your body. Healthy eating is so important. When you look at your plate, is at least 60%, half to 60% of the plate of food that you have in front of you full of vegetables? Is the smallest portion of your plate, the portion of your diet, grains? Are you getting enough protein to heal anything in your body? Well, if you check out with the USDA dietary guidelines, the government comes up with these crazy things about every 5 years, and if you look at the American diet, which we call the SAD diet, it's unfortunate how we tell people to eat. There's a lot of clued-in people out there. There's people who understand and get it. They understand how you should be eating. Our office does. Let me tell you, we do. And unfortunately, we are constantly hounding and educating our patients about what they need to be putting in their body. You need to err towards organic. You got to eat foods that will sustain you. You got to get rid of the sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives, the junk that goes in your body, the environmental crap that's out there. If you don't do that, then you're asking to build up this high level of inflammation, which is the precursor, as far as I'm concerned, in my opinion, to so many other different problems, from heart disease to diabetes to liver damage to kidney failure. We are, unfortunately, at the mercy of Fifth Avenue marketing. We are at the suspect of opinion that is not natural. It is not supportive. And yet we buy into it because it sounds great. I've said over and over again, look at the commercials that they put out there to try to get you to call your doc, to get on the certain drug, even though that they give you the ramifications, the contraindications at the bottom, meaning, you're going to die. And we still feel bad because they're so well done that we're not taking the drug and we need to go. It seems like if it's in print or if it's on the news and it's being broadcast to us by somebody who is attractive and good looking and positions themselves well, we buy it, we believe it. I think we need to think maybe 4 or 5 times about the decision processes that we make based on that kind of situation. Susan, how can I help you? Thank you for calling.
Oh, hi. This is about HDL and LDL, which is on topic today.
Okay, great.
I know you discussed ratios. However, to be more specific, can you expand on that? For instance, you wouldn't want an HDL 40 with an LDL 10. So what, in general, what would the lowest LDL in general be, safe and what applicable, and also what would the lowest, I'm so sorry, what is the highest LDL?
I know what you're talking about.
And the lowest HDL that's acceptable.
I know what you're talking about. All right, first of all, and I'm going to even complicate it more, and I wish I had the time to spend the whole program on it, but in HDLs and LDLs, there are really good HDLs and there are okay HDLs. And there are really bad LDLs and they're not so bad LDLs. So you'd have to subfraction them down, but most physicians won't do that, just like they won't do fibrinogen levels and they won't do coronary C-reactive protein levels and all of those things that really mean something to functional medicine doctors who really know their stuff. But having said that, if you have, the laboratory ranges for triglyceride are 0 to 150, and they say anything under 150 is good. In my book, anything under 100 is where you should be. Now, HDL levels, for a man, you want to be north of about 42 to 45. For a woman, you want to be north of at least 50. Anything under those things, you don't have the protective patterns to mobilize cholesterol and take them to the liver and so forth. LDL levels, in my opinion, need to be at least under 125. Now, 125, you're safe. If you've got, as a woman, if you have an HDL level of 60, 65, and you have a LDL level of 110, 115, you have a cholesterol of 205, you're probably not in a lot of trouble, particularly if you do a coronary C-reactive protein level and it's under 1. The coronary C-reactive protein level is a marker of inflammation. There's other things that you run to, A1C. So you have to take more than just a snippet picture. You have to take a lot of different things. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are in studio, 888-630-WMAL, broadcasting to you from 105.9 FM and AM 630 WMAL, as we do every Sunday at 12 noon. And we always try to keep them live. In May, covering for me will be a couple of my experts out of my office, and I'm looking forward to being away, unfortunately, for one of the weeks that I'm normally here with you. We're going to be in China. I'm going to go to Beijing and Shanghai. I've been invited to travel with a group of 10 doctors. We're going to go study traditional Chinese medicine and Tibetan medicine and see if we can come back with some things that will be more effective. We're going to have the opportunity to tour several hospitals in China and watch the application of traditional Chinese medicine and how it really works there. I'm excited. I can't wait. It's one of those bucket list things that I've, had planned on for years and years and years. And I'm glad I'm not going as a tourist. I'm going as a group, and I'll really have the ability to check it out, so to speak, and see what I can do to help all of you a little bit more than what we've been able to do so far. That's my goal. That's the reason that I do Dr. Tom Roselle Live, and we're here every Sunday at 12 noon, and I continue to try to expand the model that we have. Rick, how can I help you?
Yes, good morning, doctor. Thanks for taking my call.
You're welcome, sir. Thank you for calling.
I have trigeminal neuralgia on the left side of my face.
I'm sorry.
And it is just excruciating.
How long have you had it?
My first attack was in Christmas week 2008.
Oh, my God. So you've been suffering for that many years?
Yeah, and it'll come for about 4 months and slowly leave me for maybe 2 weeks and then come back again for a period of months.
Go ahead, I'm sorry.
It'll bring me to my knees and eyes just copiously tearing. It's just incredible.
Rick, let me ask you a couple quick questions, only because we don't have a long time.
Sure.
One, how have you been treated for this?
I am taking, once I finally got diagnosed, I'm now taking approximately 1,500 milligrams a day of gabapentin / Neurontin.
Yeah, so you're on narcotics, okay.
Right. Make me feel pretty dopey. I hate it.
All right, so before you started taking the drugs and before all this started, just real quickly, had you had any injury to your body, car accidents, falls? Had you had any significant dental work done before this all broke out?
Not significant dental work.
What did you have done?
I have had some pretty bad blows to my head.
All right. Any of those things, the temporomandibular jaw, the TMJ, is the area, obviously, where the trigeminal nerve exits. And they call it trigeminal, obviously, because it's 3 branches. One goes to your jawline, one goes to your cheekbone, and one goes to your forehead. Right. And there's a motor function and there's a sensory function. Generally, both of them are going to be affected, but the sensory portion is going to take it off the top. It can be viral, but in your situation, as I'm listening to you talk, that's doubtful. But when you have any kind of trauma that will cause misalignment of the jaw, the head, the neck, that whole area can ultimately cause symptomological representation of a trigeminal neuralgia. Now, there's a lot of things. Bad dentistry, causing a shifting of the vertical dimension of the jaw so that the TMJ doesn't hit properly, will cause a tic douloureux or trigeminal neuralgia to show up. The jaw itself, if you're grinding, if you have any wearing of the jaw, it'll cause a problem. But anyway, we see that all the time. Do me a favor, Rick. We're coming up against a break. I really would love to talk to you about this. Go to rosellecare.com. And let's go back and forth, and I'll tell you how to handle this. You can call me next week here on the program. We'll handle a little bit more. Rick, thanks a lot. I appreciate your call. The problem with this program, it is way too short. I wish I could handle your calls as lengthy as I'd like to. I want you to remember October the 20th this year, Ageless Health. That's our keynote address. This is Dr. Tom Roselle. I'm here every Sunday bringing you the most up-to-date information. See you next week. Bye.